Hello, everybody, and welcome to another episode of Conversations in Aesthetics. I'm your host, Dr. Drs Goldenberg, dermatologist in New York City. I have a real honor and pleasure to introduce our guest today, Dr. Susan Weinkle, who I've heard lecture numerous times, who has a great sense of humor, and she's famous for her tips and tricks in cosmetic dermatology. Susan, it's a real pleasure to host you. Thank you so much for being here.
Gary, thank you. I am delighted to have this opportunity to talk about my true passion in dermatology.
Well, this is going to be great. In the next 30 minutes or so, I know we're going to cover a gamut of things, all aesthetics. I know you have a lot of experience and you've seen it all from the beginnings to what we're currently using in our practice. So I want to start off with this question. In your career, in your illustrious career, how have you seen the standard of beauty, or what's considered the ideal, change and shift in the past couple decades?
Well, I would say that we have had an evolution because back years ago, we had collagen. In 1979, at Stanford University, we did the collagen protocol studies. Now, that was because the Collagen Corporation was in Palo Alto. And when we did those trials, collagen was a fabulous, exciting thing for us. The problem was it felt great, it looked great, it was great for 2 months. So it only became a $25 million drug. It never, sustainability just wasn't there. But then, thank you, Lord, in 2004, actually December 2003, we had our first hyaluronic acid, which was Restylane. 2 years later, we had Juvederm. Today, we have over 25 fillers in my cupboard. So we have seen an evolution in our products as well as our understanding of beauty. I mean, who could ever forget the parentheses commercial on television, right?
100%.
But we've evolved and understand the aging face is more than a parentheses. I mean, then we went to the cheeks. Then we went to the mid-face. Then we went to the chin. And later in the conversation, I'd hope to address further down. But I think that, to me, has what maintained my enthusiasm, because it's ever-changing our understanding of what needs to be treated and what tools we have to treat it with.
So speaking of parenthesis, I remember starting in dermatology in 2003 and getting trained to fill the nasolabial folds. And that's what everyone used to come in for, right? We used to just fill those folds. And now I think we're doing more sculpting and shaping than really filling. So when you think about where we started, let's say in the early 2000s, versus what we're doing now, where do you think that evolution from a patient perspective has gone? Are patients coming in asking still for you to fill various areas? Or are they asking for a lift? Are they more interested in a natural look, or do they still want to maybe look a little bit more exciting, as some people would say? What is it like in your practice today?
Well, for me personally, fortunately, my patients come in and say, whatever you think, Dr. Weinkle. Now that is a good patient, because they are not directing the ship. They let me chart the course. And many times, especially with a new patient for a cosmetic consult, I like to tell them, look, Rome wasn't built in a day. You didn't get here overnight. We don't need to fix this overnight. We need to have and chart a journey together. You always need to start with the bang for your buck. And many times it's as simple as a little filler and toxin in the glabella, because that is the place I think is a home run. There's nobody that looks good with deep creases here. And sometimes they don't even realize it. Their grandchildren think they look angry. I mean, I treat 90-year-old patients because their grandchildren honestly perceive them as angry. That's what these lines do for you. This makes you look sad. So I often go for angry and sad to start with. And then in our continued journey together, because it's just like this analogy. If you are going to redecorate your living room and you say, all right, we need a new couch, but the chair, well, we can keep the chair. So you get the new couch. All of a sudden, that chair is screaming at you. I hate
Doesn't
the
fit.
chair. It doesn't fit. So the same thing as we evolve in rejuvenation of the face, when you fix one thing, all of a sudden they say, well, look at this. I didn't know I had this. Well, that's because you were focused on this. And so I like to plot a journey and say that we're going to start with your biggest bang for your beauty buck. I like to call it your beauty budget. So we're going to look at your beauty budget and we're going to start where I think it's going to make the most impact. But don't worry, I have a cupboard full. And however much we need, I can do it. And then sometimes we'll see that patient in 6 weeks because by that time their toxin has kicked in. And, it's interesting. We have so many more products on the market now. We have 5 and we have 2 more coming. So I say, let's start here, but let's see in 6 weeks. The challenging patient is the one who comes in and says, oh, my grandson's getting married in 2 weeks. We're a day late and a penny short, sweetie. Because I say, I'm going to do what I can, but the optimum outcome is not going to be for over the next 6 months. And also, we've learned to look at the outer envelope, how important it is. And that's where our devices come in. I tell you that the devices, in my particular practice, my daughter joined me 4 years ago. Now, I can't touch a machine. I can't turn on the television. So I can't run those things. But I have learned
Well,
to
it's nice that you have division of labor in your office.
Yes, yes. And I can tell you, since I've watched what she can do with those machines, also, I would encourage people to look at machines and devices that you yourself, as a physician, don't have to run. Because patients really enjoy that other dimension of your practice. For instance, my nurse practitioner runs what we call our baby laser and can do other things like the microneedling. But it also lets your patient know that you have a team approach to what we can offer for them. And everything doesn't have to come from my hand and my eye.
Well, there are a couple things that I want to kind of tease out of this conversation because I think there are some hidden pearls in there. I think that this journey conversation is a very good one. I often tell patients that you don't want to have the changes all at once because the worst thing that can happen is somebody says, what did you do? What happened to you?
Yeah,
You want small changes that add up over time that really make you look the best you can at your age. It's not about looking younger in my eyes. It's about looking the best that you can for where you are in life.
right,
Because no matter what it is, you can't make somebody 55 look 25. It's impossible. Because maybe even if you have a neck and facelift, well, maybe your face looks, 10, 15 years younger, but the rest of you still looks the same age. So it makes it kind of difficult because there's a little bit of a disconnect. So I think a kind of a slow journey together where we can do small things that add up over time, I think is a very good point that you're making as opposed to doing everything at once unless there's an event that they're trying to get ready for. Um, it's interesting because in my practice, I do everything from the baby laser to the CO2 laser. And I find that it's regional because I find that a lot of people want their doctor to do everything and a lot of people trust that team approach. So it's interesting that you can do it both ways for our listeners. I think it's a good point. You don't have to do it one way. You don't have to do it the way that Susan does it or the way that Gary does it. There are multiple ways of kind of solving the same issue. So I think that's another pearl. that's very useful here. One thing I wanted to ask you, based on your experience, so it's great to have that patient that comes in and says, Dr. Susan Winkle, you're a master. Do whatever you want to do. I'm in your hands. I have no budget. I'm
That's the
here.
best.
That's the right. I want you to do the best you can for me without asking me or telling me anything else. But that's not the reality. 99% of the time, people are going to come in. They want to know, they're going to tell you what bothers them. They're going to tell you what they think they need. And it's always like a massage of a conversation. What is that art of a cosmetic consultation like for you? And specifically, what do you tell people to make them feel comfortable with what you choose for them or you think is going to make them look their best?
Well, every exam room in our office, I think we have 10, has the most important piece of equipment,
A
a
mirror.
mirror. Right, a mirror. Because I need to see what their eyes are seeing and what is bothering them. And then we transition into what I see and what's bothering me. But the first thing I need to really do is let them, if I can tease it out, share with me what's bothering them. And sometimes it blows me away. It's like, okay, it's this line right here. And I'm like, all right. But trust me, which is what the patients say, I trust you. If you don't treat that line and you do what you consider as an outstanding job, resculpting the mandible, lifting with cheek posterior zygoma, you've done a fabulous job, but you didn't treat what bothers them, miss the boat. No patient retention. That patient is going to go. Now, to me, just as an aside, one of the most challenging patients is the young patient. I love my old people because they love me. But sometimes that young person comes in and they say, oh, I really want my lips done. And I'm looking at those lips thinking, God almighty, the Lord gave you gorgeous lips and you want me to screw them up? In my head. Of course, I don't say that, but I'm looking at them. So thank goodness in our cupboard, we have a spectrum of fillers. We have very thin fillers that don't give you a lot of projection. And the nice thing is they walk away thinking, okay, good, I got my filler. And I'm thinking, thank God I didn't make you look like a duck or a yabangi. I just gently soften, but you have to make sure you're providing what the patient is asking for. And also, on occasion, have the courage to say, and I don't care if they go elsewhere. I'm not putting my John Hancock name on that work.
You have to be able to say no.
Yep.
For me, it's especially when it comes to lips. I'm glad you brought that up because, in New York City, the aesthetic has always been less is more. It's sort of
Yeah.
that quiet luxury. But then I see patients from places like LA and Miami and Dallas,
Yeah.
and everything is bigger in those places. And they want more and more and more, and you have to be able to say no. And look, I think the ideal of beauty, there are some regional differences. I really do believe that. And what may fly in some areas just doesn't fly here where I am, or maybe where you are, and you have to be
Right.
able to say no.
Right. Right.
Because you don't want your name associated with something that you're not proud of. You have to be, at the end of the day, you have to be proud of your work.
Right. So important, Gary. I agree with that 100%. And the thing is, we've actually seen a transition where there's been a 10% decrease in hyaluronic acid utilization. And I think we've had what they've termed filler fatigue. And
Agreed.
that's because, first of all, we've seen a wide spectrum of providers this day and age. I'm not pointing any fingers because I think there are physicians as well who can make those unfortunate mistakes, but people are afraid of not looking like themselves. Listen, true confessions. I've been overfilled. I've looked in the mirror and thought, Lord, did I gain 10 pounds? What in the world is wrong with my face? Thank goodness in the refrigerator If you are ever injecting hyaluronic acid and do not have hyaluronidase by bottles in your refrigerator, I'm not coming to your aid. If you have a problem, you have to make sure and I tell the patients, listen, we're going to do this. And if you don't like it, we can take it away. So that is one of the true beauties of a hyaluronidase. Now, on the other hand, we have seen a 28% increase in the biostimulators. So products like Sculptra that have been on the market since August of 2004. I mean, that's when you were starting. So we've had Sculptra a long time,
Mm-hmm.
but Sculptra never grabbed hold. First of all, it went from this company to that company. The marketing was never strong. But as patients are learning, particularly my patient population, where you go from the athlete who looks coquettic because they're skinny as a rail, or you go to that old person who's had fat redistribution and looks sunken and they think this chiseled look is youthful. Well, it's not so youthful. It actually doesn't look so good. But once you educate them on the beauty of this gradual fibroblastic stimulation of collagen, it allows for natural animation. It's not stiff or rigid. So I find it very helpful in my practice, the biostimulators.
You know, it's interesting you said that because I've done more sculpture in the past 2 years than I've probably done in the past 10 years.
Yeah,
And I think people are coming in asking for it. And I've been doing a lot of PRP and derma PRP filler where you can make a filler that's biostimulating from PRP. It doesn't last as long as hyaluronic acid, but it does give you a little bit of a filling effect or volume effect in the beginning, and then it stimulates collagen. But I agree with you. I think that certainly using less HA and more biostimulators than I did in the past. And I think it's just a
yeah,
different. I think it's the aesthetic change. I think people don't want to be overfilled anymore. And I think that's
right.
not only true in US, I think it's true globally. You know, I go to the Middle East to see patients, um, and even there where people really were overfilled for a very long time, bigger was better. There's less and less, you see less and less really protruding lips and overfilled cheeks with sunken in eyes, you know, and I think we're doing more and more biostimulators, and I think that's a good thing. I agree with you.
Yeah. You know what's interesting? In the clinical trials, which I like to participate in a lot of clinical trials, we really learn to appreciate the durability of the biostimulators. I mean, most of our HAs have 12-month indications, a few a little bit longer, but I saw clear cut 18 months, even up to 24 months durability in the biostimulators. So that's another advantage. I just tell them it's a kind of road. I don't like to put too much at one time because they walk out looking like a freaking bowling ball and, takes several days for that water to absorb. But if I say, okay, we're going to start this, as we've mentioned, the journey, we're going to do one vial. Sometimes if it's a really mature person, notice the terminology down here. If it's that mature person and they look sunken, then I'll put two vials. But oftentimes I'll put one vial and then say, in a few, week, you're going to think, oh, I got nothing because the water gets absorbed and the biostimulation hasn't started. But you come back and see me in 6 weeks and we're going to add to what we've done. And the other thing I love is because it's injected in a subcutaneous plane, and I wonder if you see this as well, I don't see as much bruising with the injection of even I treat tons of people on everybody in my town is on some anticoagulant. We should put it in our water because it's so, but I really don't see the bruising with the biostimulators that I do with HA.
You know, there are a couple points I want to tease out here because I think they're really important, especially when it comes to biostimulators. I'm with you. When I do something like sculpture, if I'm doing the cheeks, it's usually a single vial split half and half because
Mm-hmm.
I'm usually diluting it with 6 to 7, sometimes 8 cc's of lidocaine and saline or sterile water, and they do walk out really looking kind of crazy. I still do the massage. I don't know. I'm into that whole 5-5-5. 5 times a day for 5 minutes for 5 days. You're not doing it anymore.
Respectfully, I recall in the early 2000s when Danny Vlegar, who was
Uh
a
huh.
family practice doctor in Switzerland, came up with the 555. Back then in Europe, they were doing a 3cc reconstitution. And then when we got approved here in the US, we were doing a 5cc reconstitution. But now, since we reconstitute with 8 or 9 cc's, I mean, knock wood, I haven't
You
seen
haven't
a
seen
nodule for it.
nodules. You know, I like giving patients homework. I think it makes it more. I think it's a different experience for them because it's almost like a buy-in. And what I usually like to do is I like to ask them to massage in a certain way. It's like we're creating a vector. We want to try to lift, so we're going to push up towards the top, the top of the earlobe. So they're sort of massaging one way up, and it gives them something to do. And I feel like the swelling doesn't last as long because you're manually kind of getting rid of the fluid. But that's just my thing. Like I said, there's many different ways of doing it, but it's really the consultation of explaining um, sculpture specifically that I want to just tease out with what you do. So I'll tell you what I do, and I want to hear what you do. I usually tell patients that there's a bell curve response because everyone's going to make a certain amount of collagen. We know everyone's going to make some collagen, but there's some people that are going to exceed expectations, and some are going to have a little bit of a lackluster response. And then as far as the longevity, I think there are some people that have naturally very high metabolism. It may not last as long for that person as someone who maybe doesn't break collagen down. And I think there are some there's some differences in age because I think our ability to regenerate tissue does decrease with maturity, as you said. But I want to hear in your particular population exactly how you counsel them because I do think that there is a difference in response from patient to
I,
patient.
I totally support that concept. I find that for me, that mature person, they get it. It's going to take a little longer to get to that home run, and they may require a little more product over time. However, I find the most challenging patient that workout obsessed soul who's, got a BMI of, negative numbers. And I say to them straight up front, Botox doesn't last as long.
Nothing lasts as long.
Nothing lasts as long. I said, look, you want to exercise it right out of your face? Get a night job so you can come and buy more. I mean, I really think that it has to be individualized. And the art of the biostimulator is really, as you have so importantly mentioned, it's in the consultation. It's in explaining expectations. With everything we do, we have to put a box around what are your expectations? Is this going to be, in your neck of the woods, a $200,000 facelift more? No. Are you going to feel and look better? Yes. And so I really feel like that initial bonding and with the patient and expectations is what makes all the difference.
Agreed completely. Okay, let's pivot to what you came to talk about, which is the regeneration of the neck.
Yes.
I
Yeah.
think young Lou's going to play the video that you brought for us. So I would love to hear you talk through what you're doing and how you're doing it and why you're doing it.
Okay. Before we play the video, if I could just give a little intro to it.
Let's do it.
All right. All right. So we know we treated here, we treated there, we gave people chins and lips, and we did all this. And we somehow thought rejuvenation stopped here. Well, since I'm a little mature, I started to look down myself and said, oh, goodness gracious, all this is good. Mandible sweep is good. We're looking all right. But I call it the neglected neck. And thank goodness the pharmaceutical companies are coming on board as well. We now have done 2 studies for platysma injection. And the platysma is a great big muscle, very superficial. It does not stop here. It goes over the mandible. Don't forget that. That's why we do 2 little injections of toxin here to soften what's pulling down on this mandibular sweep. So we've got this platysma. And before I do any fillers or anything in the neck, I like to relax the platysma. It's FDA approved. It's going to be even more companies are looking at we're doing more clinical trials There are different ways to approach the platysma. Years ago, Derek Jones started with looking at the ringlet lines and doing a hyperdilute formulation and just coming in the ringlet lines. Now we tend to ask people to provoke their platysmal bands, grab the band, inject the platysmal band, but don't forget that platysma comes all the way over. So your first order of business is to relax the muscle.
So Susan, how much botulinum? Let's use Botox because I
Yeah,
think
yeah, yeah.
that's one that most people are familiar with. So an average platysmal bands injection, how much botulinum toxin are you putting in?
Uh, well, you got to remember, I got mature people, but about 40 units.
40
And so,
units.
yeah, and you can see them back. I find what's interesting is this lasts a pretty long time, but I see them back in 6 weeks because sometimes I might have missed a little band or I might have not. You don't want to follow it down too far, even though it's tempting, because the lower portion of the platysma is actually an elevator and the upper 2/3 is more of a depressor muscle. So I like, if it's your new botulinum toxin neck patient, I like to see him back in 6 weeks and kind of critique my work and say, okay, we're getting your refined recipe and I've got it in the chart. And so we know this is your recipe for how to approach your neck.
So you're
And I
putting 40 units the first time you're seeing them
frequently, yeah. I'm
frequently.
doing a clinical trial right now. We are putting 90 units. I
Mm-hmm.
thought, oh my God.
It's a lot.
I thought, but I think it's also how we're injecting. We're grabbing the band and we're going tangentially. So we're making sure we're very superficial without a lot of diffusion. And when I started, I even told the company, like, are my patients not going to be able to get their head off the bed? I mean, that seemed excessive to me. But, I think, again, this is like we've talked, you have to individualize it. A younger person, not a real prominent band, I might start with 20 units
I
because you
think
can,
that's fair. 20 to 40, I think, is fair.
yeah, you can always go up. There's no eraser for this. I will tell you, years ago, I injected my
Oh, I
platysma.
love this story. I heard you tell the story. I love the story.
This is before we were even doing this. So I inject my neck. I go to my Pure Bar class. I'm looking okay. A few days later, I go, I don't really think I did enough. I better touch it up a little bit. And this is, I always inject myself. So I inject a little more. I go to my Pure Bar class. I go, whoa, head is not coming off the floor. I mean, I could still swallow water. Years ago, Alistair Crothers injected Jean with 100 units when they first started. She couldn't swallow water.
I think this is what the kids say. This is when the kids say, "Don't get high on your own supply." So maybe you should have given yourself a little more time. All right. So you're doing botulinum toxin. You kind of touched on the tech neck. That's the horizontal bands, which we're now seeing in younger and younger patients because they're sitting, looking down at their phone all day long.
Or
So
computer.
or computer. So you're using hyperdiluted what Radius, Sculptra,
When
hyaluronic
I'm
acids.
when I'm filling the neck, and I will give credit to my two girlfriends, Kimberly Butterwick and Sue Ellen Cox. We were three together, and we looked at the neck and said, we're just not cutting the mustard with the neck. So we decided to make hyper dilute. You have to take a 20 gauge syringe, a 20 cc syringe, okay? And you mix a 16 cc hyper dilution of Sculptra. And the icing on the cake is to mix in a little HA, light HA, whether you use silk or density. We got good things in the cupboard. You mix because you need a little bit of immediate response as well as then the delayed response with the Sculptra. Now, when we first did it, we were thinking, man, this is scary, right? There's a lot of stuff down here. So I recommend before you tackle the neck with injection, you go and look at the anatomy. Now, the good news is the sternocleidomastoid is actually, I look at it as the great protector. And the reason is it's on top. And as long as you stay on top of that sternocleidomastoid with your 2-inch cannula,
All right, so let's go to the
you're
video.
okay.
Let's go to the video
Here,
because I think that's what you're explaining.
Yep. You see that prominent? And this lady is 75, kind of my average patient. All right. So I use a 22 or 25 gauge 2-inch cannula. Now, Sabrina Fabi uses hyperdilute calcium hydroxylapatite, which you can do as well. And she makes 3 injection points. I find that if I come just beneath the gonial angle and 1 injection point with a 2-inch cannula, in most patients' necks, I can fan it all across. And I come laterally because as you tighten laterally, you'll see improvement
Immediately.
medially.
Yep.
But you also, expectation wise, this is not one and done. Most patients require at least 3 treatments.
So this is Sculpture mixed with 16 cc's of lidocaine saline sterile water.
Yeah,
Plus
only
a,
1 cc of lidocaine. You know, you don't really need much lidocaine.
right. Plus a
And I use
vial of
lidocaine plain.
HA.
Lidocaine plain.
You're not
Yeah.
using it with you're not using lidocaine with epinephrine.
No, because the epinephrine burns. And I like to be, as painless as possible.
Painless dentist is the best dentist. I agree with you.
Yes. So 1 entry point. The other point is you don't want to come too superficially because you want to maintain this definition between the mandible and the neck.
So are you subdermal? Are you in the sub-Q? Or are you intradermal?
Probably sub-Q. You're pretty superficial because and it's so dilute. I haven't seen nodules. It's nice. I run it over that sternocleidomastoid. Now, because we're experimenters, one time my girlfriends and I decided we might as well mix the whole shebang, right? So we put in a little botulinum toxin in our mixture.
Mm-hmm.
Not a good idea.
What happened?
Oh my God, the things I do. My friend injected me too superficially toward my mandible, and it's such a dilute concentration. Guess what?
It spread.
This is how I walked around my office for about 6 weeks. We knocked out my DLI and my DAO. So I was like this. It was awful. I couldn't brush my teeth. I had to hold my mouth because the water would drain out.
Oh my goodness.
I would say that
don't try this at home, people.
No, leave the Botox out of the mixture. But I'm just telling you, I've already been down this road. I'm saving you from that experience. And the good thing is, it wore off. I just looked a little wacky for a bit. Yeah. I did put some tox over here to try to even myself out, but then I couldn't really talk at all.
Boy, that was something, I bet. So let's say that you have a younger patient with a tech neck with the horizontal bands.
That's a good terminology.
Yeah. So what I usually do is I inject it directly into the bands. I'll use a hyperdilute Sculpture or Radius, sometimes mix in an HA in there like you do just for that immediate result. And I'm just literally making tiny aliquots as I'm, sort of marching along that band. Do you ever use that technique, or you're always injecting with a cannula and trying to sort of stimulate collagen in the entire neck?
I think we should do both. I think there's a lot to be said for marching along the band, same with a little toxin along the band.
Mm-hmm.
But I do think you still need that more global lifting. And so just marching along the band is not going to give you that same lifting that I see when I inject both sides like that. So just like everything else, we've got to learn from each other. I think maybe I'll try a band or two, but I can't give up this global lift.
So you like to do, but it's really a holistic approach. It's really what it is, right? It's a holistic approach to slowly improving the patient's appearance over time. And I agree with you. I think the neck has been neglected. And I think, for me, it's the face, the neck, the décolleté in women, and the hands. Those are the things that really age you. And those are the things we always like to address.
But the thing is, because there's been so little attention toward the neck, patients don't come in often and say, can you inject my neck?
That's right.
This has got to be one of those guided things where you have to inspire that patient and say, listen, you're not going to love one injection. If 3 injection sessions aren't in your budget, I don't like people to not be happy with me.
Correct.
I like to make sure that I say, all right, here's what needs to be done if we're taking this route. And I think that our fillers plus the combination of some of our devices really makes a match made in heaven.
I agree, and I think the devices are getting better. But what's interesting is that I'm going back to doing more CO2 resurfacing. I've probably
Yeah.
done more CO2 resurfacing in the past 2, 3 years than I've done in the past 5 to 10 years. People understand that you don't get something for nothing, so they're willing to take that downtime once a
Yeah.
year to
Yeah.
really, to really take that big eraser and erase those fine lines, wrinkles, pigmentation, etc. Okay, Susan, before we conclude, I'm going to put you in the hot seat. Okay, so I'm going to ask you some rapid fire questions, and I want you to just say the first thing that comes to mind. Remember, this is a family show. Um, so the first one is your favorite. What is your favorite botulinum toxin and why?
Um, Dysport. And
Okay.
the reason why is it's a good bang for your buck. I think it's predictable performance, but I will comment that I have all the fillers, I mean, all the toxins in my office. Um, Daxi, I like Daxi. I think it's a nice focal. I think you just got to know where to use what, and they're all similar but slightly different. And Dysport is my main go-to product, mainly because I make a good bang for my buck out of it. Price point is good. I did all the Jeuveau studies. I think it's very similar to Botox. Daxi, unfortunately, came out of the gate saying that it was a premium toxin. And unfortunately, in about half the patients, it wasn't that premium and we were charging a lot. So that evolution, but we still have Daxi. I mean,
Mm-hmm.
I got to provide everything.
So if you could pick one to inject the rest of your career, it's Dysport.
Yeah.
If you could pick one filler that you could use, your favorite one for the rest of your career without reaching for something else, what would that be?
Sculptra. And I often say, if I'm going to a desert island, I'm taking Sculptra.
So Sculptra is is your favorite today. That's what you use the most.
Well, I,
So are you
I
comfortable? Where are you comfortable injecting it? Because I inject Sculptra only if my needle can touch bone, usually, unless I'm really hyper diluting it and I'm using a cannula. So tell me your kind of technique and how you've refined it over the years.
I use a 25 gauge 1.5 inch needle. You can't use the blue hub one. You have to use the orange hub one.
Mm-hmm.
The blue hub XL does not have a smooth lumen.
It
And I almost,
clogs right
it
away.
does. It clogs right away. I
Mm-hmm.
almost threw the whole
Agreed.
thing out because I was like, this is not fun. But if you use the orange hub one, it's got a very smooth lumen, 25 gauge, 1.5. Now, what I have learned to do, because when I was doing one of the clinical trials and we were doing nasolabial folds, I went in and injected, and all of a sudden I saw the whole nose blanch. I was like, holy crap, I'll never get to do another clinical trial in my life if I necrose this woman's nose. So I take it out, I rub it, it pinks up, I go, okay, I'm out of the woods. What I've learned to do now, since I like to use the needle, it's in a subcutaneous plane and I don't get much bruising. But if in a high risk area, I start injecting slightly, get a little anesthetic on board, but then I stop injecting and I go all the way to the piriform fossa and I inject retrograde. Now, I haven't had any blanched noses since I changed that technique. Um, but I really think that this is a higher risk area than we've ever appreciated. And so that retrograde technique, and then when I come, like usually they're hollow right here. And so I start here and fan, and then I push up, which gets them a little up here and gives them a little bit of a lift. And I think, but it's not a structural filler. Like if somebody looks at wanting their mandibular sweep resculpted, I don't see that's where my Sculptra is the best utilized. I think it is like we talked in the very early days. It's a global
So
approach.
mid face and zygoma.
And the other thing is we haven't ever given it enough credit for thickening the dermis improving the quality of the skin.
Skin quality definitely improves. I agree with you 100%. You could see it. I mean, you could definitely see it after several injections and,
Yeah,
waiting 3 to 6 months afterwards just to give the dermis time to make some collagen. Okay,
yeah.
your favorite device to use in your office.
Um, well, as I said earlier, I can't turn the television on at home, okay? So I don't really device, but my nurse practitioner, or about to be an RN in Florida, they can do it. That Clear and Brilliant, man, oh man, it blows it out of the water. I mean, we sell it as a package of 3. They can come once a month, every couple of months, doesn't matter. We have so many patients that say, I want to sign up for another package. I want to do it once a month. I'm like, go at it. The nice thing is, it doesn't hurt as much. There's very little downtime. You're red that night, but you can go out to dinner, put a little makeup on. Now, my daughter would tell you the Fraxel. She loves that Fraxel, and she can turn it up, turn it down. So I mainly like to refer my patients to the team for devices that you can control the pain. I mean, if you paint them, you won't retain
Mm-hmm.
them. You got to control the pain. You got to make sure they're getting a bang for their buck and the outcome. I have purchased, and I don't want to say, but I have purchased one device that I thought, people on the podium say it doesn't hurt. I don't know what they're smoking, but I can tell you,
Will you name the device?
do you think I should?
I think you should. This is not sponsored. This is
Okay.
for people
Okay.
to
This is
learn.
true. I did the soft wave 3 times on my maturing neck, and we took good control pictures. It hurt like the devil. I'm not even a drug taker, and I took half a Lortab, and nitrous oxide. And for me, you're talking to a woman who injects herself. For me, I didn't see enough outcome
Mm-hmm.
for what I had to give in terms of pain. Now, there wasn't a lot of downtime, but I didn't feel so. We sold it to one of our colleagues in New Orleans, actually. But the other thing is, I think it is the market. All right. So my market are old people, mature. I mean, I don't really have a strong population in that 30 to 45 range. And so for people who have minimal laxity and that range, I mean, my friend I sold it to, she loves it. So I really think you have to look at what fits in your patient population.
I think that's a great point. I think making sure that the device or whatever it is that you're doing is appropriate for your patients is super important. Otherwise, it's you're going to spend a few $100,000 and it's going to collect dust
Right.
in your office. Well, I'll tell you, this has been a very nice and interesting and fun conversation. I really appreciate you coming on the podcast, and I hope everyone listening enjoyed it as well. I know they will. Thank you for always teaching us in a fun way. I think a lot of us will take lots of little pearls from our conversation. So thank you, Susan, for being here. And I appreciate everybody watching and listening. And until next time, we'll see you at Conversations in Aesthetics. Thanks, everybody.
Thanks for having me.
Looking for more conversations like this one? Don't stop here. Explore the full lineup of podcasts from Derm Squared, where dermatology industry leaders, innovators, and experts share insights you won't hear anywhere else. Visit dermsquared.com/podcasts.